The birth control pill is turning 50, and up next, we're going to take a look at how contraception has changed over the years. San Diego Living, back right after this.
It's been keeping people free from unwanted pregnancy for 50 years. We are talking about the pill, and it celebrates its 50th birthday today. The changes this popular contraceptive has undergone are many. And here from Alvarado Hospital, we've got Dr. Lila Schmidt to talk about it. It's 50 years. It's gone through a lot of changes, and you said it's not your mama's pill anymore.
No, it's changed. The pill that your mom or grandmother took has a much higher dose of the hormones that are in the pill. There's two hormones, estradiol, which is the estrogen, and a form of progesterone. And it used to be much higher doses to the woman, as opposed to nowadays, it's very low. And that's why you call it the low dose pill. So it has different risks, less risks, and it still has the same benefits.
You were saying that a lot of women will go into your office and say, is it going to make me gain 20 pounds? Am I going to have all these side effects? And of course now you're saying, there's more. It's come a long way.
It's come a long way. Having the lower dose estrogen decreases your chances of having a blood clot. It decreases the weight gain that some women will speak about. The low dose pill, the major risks are if you don't take it exactly at the same time or within an hour, you can have spotting. And if you miss the first couple of pills, that's how my best friend has 2 sets of twins.
Oh, 2 sets of twins, my goodness.
Within 2 years.
Well, so contraceptives in general, lots of women take them. And when women come to you to talk about different options, what do you tell them?
Basically, in my practice, it's individual based. Depending on the woman and what she wants, if she wants permanent sterilization, there is surgical. You can either do a procedure on the man called a vasectomy. You can do a procedure on the woman called a tubal ligation. You can do it right after birth. You can do it between births. And then if she doesn't want permanent sterilization, then you can talk about either barrier methods, which would be the condom or the diaphragm, and you can talk about hormonal methods. And hormonal methods you can dispense in many different ways. You can have the pill, which we're talking about today. You can have the IUD. There's an old IUD, which is the copper, and there's a new IUD, which is progesterone, called the Mirena. There's the patch, and there's Depo-Provera, which is injection. So they all have their pros and their cons. So it really depends on the patient, what she's comfortable with, what her health is. So it's individual. It's not, in my practice, it's not one size fits all.
Right. And speaking of the pill, since it's the 50th anniversary, not all women take it to prevent pregnancies. There's other reasons as well.
There's lots of reasons. I mean, I do infertility, and so I will use the pill to schedule your period. Let's say you have an egg donor and I want you guys to have your period on the same day. I can manipulate your period so that you will have your period the same day as your egg donor or your surrogate to cycle you. You can also use the pill if a woman comes in, she has ovarian cyst. If it doesn't look malignant, you can put her on the pill. I'll give her the option of waiting a cycle versus taking the birth control pill, which sounds funny if you come in to get a baby and it's like, my doctor
wait a minute, isn't that the opposite of what I'm trying to do here?
Exactly. But you can also use it for if you have dysmenorrhea, which is painful periods. It will decrease that because it decreases the blood flow. Insurance companies will ask you to use it on patients who have fibroids. It has very little effect on fibroids, but in their minds, they think that it will help a person so they don't need surgery.
Dr. Schmidt, what do you see in the future? I mean, 50 years, it's come a long way. What are our next steps in contraception?
I think the next steps will just be tweaking what we have, because what we have is very good. It would be nice if we could get something that had 100% guarantee. There is none.
That's why your friend has 2 sets of twins.
Exactly.
Okay. Well, thank you so much for coming on today. And, if folks are thinking, that they might need some oral contraceptive, they can always come and chat with you. And there is the information for Alvarado Hospital, their 1-800 number, and their website. And any last words on this 50th anniversary?
No, I just think it's wonderful that women can utilize modern medicine. And the big thing about the pill is you need to know it decreases ovarian cancer. And ovarian cancer is a killer.
All right. Thank you so much, Dr. Schmidt. Good to have you on today.
Thank you.